This is Dr. Judson Brandeis, board-certified urologist and men's sexual health expert. I am here today to tell you about Spunk, our newest supplement for prostate health. The prostate is a gland located below the bladder. The function of the prostate is to produce semen. The urethra passes from the bladder through the prostate and then through the penis. Once men hit the age of 40, the prostate begins to grow. For some men, the prostate can enlarge to the point where it compresses the urethra. This non-cancerous type of growth is called benign prostatic hypertrophy, or BPH. There are many supplements that have been known to have beneficial effects on the prostate. There are also many that do not, and yet they are still advertised for prostate health. The ingredients that I chose to put into Spunk have published data from scientific studies. Spunk can be taken alongside more traditional BPH medications such as alpha blockers or 5-alpha reductase inhibitors. There are 5 main ingredients in Spunk. These ingredients have been shown to be safe and effective, and we've also sourced them from high-quality producers. They include Beta-sitosterol, Pygeum africanum, flaxseed extract, pumpkin seed extract, and zinc. Here's where things get a little bit more scientific. Beta-sitosterol is a phytosterol. This is a plant-based steroid alcohol that our bodies can't produce naturally. Beta-sitosterols have been shown to have a number of positive effects, though the exact mechanisms have not been yet fully elucidated. We do know that beta-sitosterols inhibit the absorption of cholesterol from the intestines. This results in a decrease in bad cholesterol without a decrease in the levels of good cholesterol. Another potential effect of beta-sitosterol is an anti-inflammatory effect. Studies have examined the use of beta-sitosterol in men with BPH and found that treatment relieves symptoms related to an enlarged prostate. One particular study reported significant improvement in urinary flow and frequency in men with moderate BPH. Pygeum africanum refers to the bark of the African plum tree. It contains multiple compounds including tryptorines, ferulic acid esters, and phytosterols, including beta-sitosterol. Tryptorines are a group of precursor molecules that plants use in the production of steroids. Pygeum africanum has been a very popular supplement with formal use in BPH as early as 1969 in Europe. Interest has been so high that the plant is now endangered, with quotas for harvesting placed in South Africa where it is primarily grown and harvested. I've examined 13 randomized controlled trials studying its effects in BPH and found that 12 reported positive impact in at least one domain of BPH-related symptoms. One systematic review of Pygeum accumulated data on 1,500 men. Compared to placebo, those treated with Pygeum were twice as likely to report an overall improvement in their BPH. Some specific outcomes include reduction in nighttime urination, increase in peak flow, and reduction in residual urine volume. Flaxseed is a common ingredient known to contain SDG. SDG has a few studies to examine its use in relieving BPH symptoms. Overall, it's been reported to improve quality of life in men with BPH. Similar to beta-sitosterol, SDG has an added benefit of lowering cholesterol levels, as well as lowering glucose levels and having an anti-inflammatory effect on the prostate. This means that in addition to prostate-specific health improvement, SDG has cardiovascular benefit as well. One very interesting study compared SDG at different doses to placebo in men with BPH. After 4 months, they found men treated with SDG reported reduction in their BPH severity from moderate to severe down to mild. Specifically, there was a trend toward an increase in maximum urinary flow rates and decreases in residual volume after urination. Pumpkin seed oil is a common ingredient in supplements and cuisine around the world. It's a natural source of mono and polyunsaturated fatty acids, which are known to have a benefit for cardiovascular health. The current body of literature examining its use in prostate health is smaller in comparison to some of the other ingredients in spunk. However, the studies have been completed and show great promise. One particular study demonstrates an effect for pumpkin seed oil to improve the delivery of other BPH medications. Additionally, it had the added benefit of promoting cardiovascular health, which can improve many bodily functions overall. One systematic review found 10 lab studies and 6 clinical studies on the use of Cucurbita pepo in prostate health. The laboratory studies consistently demonstrate potential for anti-inflammatory effect and reducing prostate growth. 4 of the 6 clinical studies demonstrated improvement in BPH quality of life scores and more objective urinary flow measurements. Chronic zinc deficiencies have been shown to potentially increase the likelihood of developing benign prostatic hypertrophy. Taking zinc supplements or increasing dietary intake of zinc may help reduce urinary symptoms associated with an enlarged prostate. In my research and practice, I've come across many supplements that don't appear to be effective or have questionable uses. While knowing the right ingredients to select the supplement that's right for you, it's important to be mindful of the supplements that don't work or haven't had enough research to determine that they're safe and efficacious in prostate health. I've found that saw palmetto and stinging nettle, while they may be useful in other aspects of health, do not have the evidence base for me to support their use. I recommend avoiding supplements with these ingredients when the goal is optimal prostate health. Saw palmetto refers to the fruits of the saw palmetto tree. Many studies have examined its use in both BPH and prostate cancer. In terms of BPH, one large study of 225 men compared the use of saw palmetto to placebo and could not conclude that there was any significant difference between the two in terms of quality of life scores, maximal urinary flow rate, prostate size, residual volume, or serum PSA levels. Spunk is your prostate health supplement containing beta-sitosterol, Pygeum africanum, flaxseed, pumpkin seed oil, and zinc. This is board-certified urologist Dr. Judson Brandeis. Order Spunk today at AFFIRMscience.com.